Shoulder resurfacing surgery, instead of replacing the whole ball of the shoulder, we're just shaving some of the cartilage and a little bit of bone off of the top of the humerus, and we're putting a little cap over it, saving some bone so down the road, if we ever needed to do a more invasive type of surgery, we're restoring as much bone stock as we can. Reverse total shoulder arthroplasty is a neat design where instead of putting the socket where the socket's supposed to be and the ball where the ball is supposed to be, we actually reverse them. And it makes it a more stable implant so that we don't have to worry about dislocations and instability afterwards as well. Most of my reverse total shoulder arthroplasty patients go home the same day. We do let them do some gentle, easy range of motion starting from post-op day 1, but we increase the exercises gradually. The whole recovery process is probably about 4 months before patients are able to do more physical activities.